Hello, my name is Dr. Boyce. I am the pain specialist physical therapist with the pain clinic here at the Washington, D.C. VA Medical Center. If you're watching this presentation, it's probably because you have questions about pain. In fact, it's very likely that you are one of many veterans that have been suffering from pain for a long time. You might want to know, why do I always hurt? How is it possible for pain to persist beyond normal healing times? And more importantly, what can be done about it? Our pain clinic has developed this presentation to help answer these questions and many others. Because we know that for treatment to be effective and for you to be able to take control of your pain experience, you must first accurately understand what pain is. In the medical system, we have traditionally thought of pain as being either acute or chronic. When pain is experienced close to the time that tissues are being irritated or become damaged, and the severity of the pain matches the amount of damage or irritation, we refer to that as acute pain. Effectively treating acute pain is simple. You just reduce the source of irritation and protect and assist the healing process. After a few hours, days, or even weeks, the pain resolves. Sometimes, however, pain can persist and keep reoccurring even when tissues have healed. Or a person may experience severe pain when there is just a small amount of irritation, or even no tissue damage at all. When this occurs, we call it chronic or persistent pain. When this happens, it can cause a lot of suffering and really interfere with someone's quality of life. Applying the same treatments to chronic pain that you do to acute pain does not tend to deliver good results. And any results you do get don't tend to last. To effectively address pain that is chronic, your plan of care needs to be different. And by the end of this presentation, you'll understand exactly why. There are a few things that are important to keep in mind about pain. Just like your sense of sight, smell, and hearing, pain is a normal human sensory experience that is produced by the brain. Many times, patients with chronic pain have been inappropriately made to feel as if their pain experience is somehow less real than pain that is acute. That is absolutely not true. All pain is always 100% real, regardless of how much irritation or damage there is to the tissues. Pain that has become chronic is not in your head and is not imaginary. You may also be surprised to know that chronic pain is a lot more common than you might think. And with the right type of treatment plan, things can get a lot better. You can get more control over your pain and improve your quality of life. Most of you watching this presentation probably have a thorough understanding of the problems and suffering caused by having pain that persists. But is there any value in having a nervous system that can produce the experience of pain? What is pain's purpose? Pain is sort of like the body's alarm system. In a home alarm system, there are all sorts of sensors throughout the home that detect different types of events. Some detect motion, some detect smoke, some detect if a door is open or the sound of a window being broken. These sensors produce signals that are sent to a computer or the brain of the system. This computer takes this information and determines if there is a threat. If it does, like when someone breaks into a window, it sounds the alarm. When the alarm does sound, does it produce a nice, soft, soothing, calming sound? No, that's ridiculous. That would get the complete opposite kind of response you would want. In an emergency, the last thing you want someone to do is to take a nap. The alarm makes a sound that is annoying, jarring, loud, sharp. Some might even describe it as painful. The reason for this is to get you to do something. Call the police, the fire department, climb out the window, or at least get up and turn the darn thing off. In a similar way, pain has to be painful. Let's say you step on a nail and it pierces right through the bottom of your foot. If that felt good, or at least just didn't hurt, then you would continue to walk around with a nail in your foot. The fact that our brain produces pain when these types of things occur is what drives us to remove the nail, protect the injury, and eventually go get medical help. In our body, we have all sorts of sensors that deliver all kinds of sensory information about our tissues and the outside environment. Our brains are automatically processing all this information all the time and constantly creating our sensory experiences. Have you ever heard that we only use 10% of our brain? That's a complete myth. The majority of the brain is very active most of the time. We are only conscious of a small portion of what it does.
Let's start to look more closely at how our body's alarm system actually works. When the tissues of our body get irritated or damaged, there is a special type of signal that is produced, sent to our spinal cord, and then relayed up to our brain. This signal is called nociception. All sorts of things can produce this signal. Inflammation within an organ or tendon or joint, like an arthritis or tendinitis, that produces nociception. If tissues get torn or bones get fractured, that produces nociception. A nerve or nerve root can get overcrowded or compressed, like in a radiculopathy, commonly called a pinched nerve, or a nerve's protective coating can get damaged or degraded by a disease process, like in peripheral neuropathies. All of these events produce irritable signals that are sent from the tissues of our body toward our brain. Now, when we discovered nociception, we thought we had discovered what pain was. We thought that pain was this irritable signal from damaged tissues. We thought that nociception would travel to the brain and create the experience of pain. But some things didn't quite fit. In reality, nociception is actually being produced all the time during normal daily activity, even when most people don't generally experience pain, like during bending, walking, stepping off a curb, or sitting. This made us start to question some things about the relationship between this irritable signal called nociception and pain.
If pain is an experience that is produced solely by this irritable signal, there are certain things that would have to be true. If pain is nociception, then every time nociception is produced, we should feel pain, right? What about daily activity? We already showed that daily activity produces nociception, even when people don't experience pain. When we developed the ability to use X-rays, CT scans, and MRIs to take pictures of the inside of the body, anytime someone would say they had pain, we took a picture to see what was going on. Sometimes we found serious issues in the tissues that explained a person's pain. Sometimes, though, we just found the presence of some arthritis or degeneration and inflammation. Since we knew that inflammation produced nociception, we assumed that that must be the pain generator. But then some scientists asked the question, how many people out there who don't have pain have arthritis and degeneration? So they did some studies where they randomly gave thousands of people MRIs, X-rays, CT scans, you name it. They also gave them a questionnaire that would ask about their pain. You know what they found? They found that most people, even those who said that they don't have pain, have degeneration and arthritis. They even found that 37% of 20-year-olds who said they don't have pain have degenerative disc disease. Other scientists did studies and found that people can have all sorts of tissue problems without having pain. Rotator cuff tears, meniscal tears, ligament tears. When it comes to pain, there is much more going on in the brain than just inflammation and injury. There are also lots of cases where car accident victims or combat veterans suffer severe injuries and don't experience any pain at all until hours or sometimes days later. We usually call this shock. The reality is, there are lots of examples of nociception being produced without someone experiencing pain. If pain is just irritable signals from the tissues, then the amount of pain you feel should always equal the amount of signal produced, right? What about paper cuts? I know it's a silly example, but why do those things hurt so much? There isn't much tissue damage at all, but they can hurt so bad. Something doesn't fit. How about this statement? If pain is just nociception, and nociception is what produces pain, then it should be impossible to experience pain without there being any nociception. Let's say someone has an amputation at their right knee. They have no right lower leg and no right foot. Sometimes, months or even years later, this person may develop very real and severe pain in their right foot. This is called phantom limb pain. In this case, there is no nociception coming from the right foot because there is no right foot. Yet the person is having pain in their right foot. The same thing can happen when someone has what's called a nerve root avulsion. This means that the nerve root is completely detached from the spinal cord. In this case, there is no nociception. In fact, there's no signal at all going to or from those tissues that are fed by that nerve. Sometimes, months or even years later, a person with this injury can develop very real severe pain in those tissues that were fed by that nerve. In a few minutes, I'm going to explain how this is all possible. The reality is, when it comes to pain, there is much more going on in the brain than just the signals coming from the tissues of the body. I think you get the conclusion that we have to come to regarding the relationship between the experience of pain, nociception, and the signals the brain receives from the tissues of the body. But if pain is not nociception, that leaves an obvious question. And that is the question we'll answer right now.
Pain is actually an experience produced by the brain when it perceives that there is threat to the tissues of the body and that some response is needed. There are about 8 to 12 areas of the brain called the pain neural signature that create pain. When these areas become activated in a coordinated way, 100% of the time that person will feel pain. When the pain neural signature is not activated, 100% of the time that person will not feel pain. And this may be regardless of how much irritable signal is coming from the tissues of the body. The areas that make up the pain neural signature are the areas responsible for sensation, movement, stress response, anxiety, memory, threat assessment. These are all the areas of the brain that we would expect to be part of our threat assessment and protective response system. When the pain neural signature perceives threat to an area of the body, it will not only create an experience of pain, it also will produce the multimodal responses our body uses to protect: muscle guarding, inflammation, a stress response, fear, and anxiety. And you may ask, on what does the pain neural signature base its perception of threat? On everything it has access to. Yes, the amount of nociception from an area of the body can contribute, but that is only part. Prior experience of an injury or traumatic events, the feeling of anxiety or fear about an area of the body or a situation, the amount of stress you're under, your thoughts, your mood, and even sometimes other sensory input that seem completely unrelated, like temperature, weather changes, or sensory input from normal daily activity. All of these things can factor in. Now I know this is a lot to take in, but in part 2, we are going to break it all down in more detail so you really understand.
Please progress to part 2 of the pain education presentation, where you will learn exactly how the brain creates our experience of pain and how pain can sometimes become chronic.